3 of the Children's Hospital, and I'd like to show you behind the scenes of something that all Victorians should be very, very proud of. This is a specialised MRI machine that can swing between 3 different theatres. It's the first machine ever to be seen in an Australian children's hospital, an incredible piece of equipment that costs $12.5 million and has completely changed the way we perform different types of surgeries here at the hospital. For example, previously, if a patient was having a brain tumour taken out or resected, they would have to have the tumour removed, then be taken over for an MRI scan, and if any tumour remained, have to have a further operation. This machine enables us to perform the MRI immediately during the surgery, which means one admission, one anaesthetic and only one surgery. I want to introduce you now to Glenn, who's our senior technician here. Glenn, how has this machine changed the way that we perform these types of surgeries and investigations at RCH? Well,
having an MRI available in the theatres means that we're much more flexible around particularly complex patients that need an anaesthetic. We can do that in a very safe environment. We can image at the point just before they have an operation or during an operation or immediately post-operative if there's been any complications. So it's given us a lot more flexibility, particularly with our inpatients, but with some of these complex cases that we see surgically.
Thank you. It's brilliant. And another thing that this machine helps us with is not just neurosurgery, but also cardiac surgery as well. And here we have the Director of Cardiology, Michael Chung. Can you tell us, Michael, how does MRI help in terms of children with heart disease?
Lots of different ways. We have very high quality imaging for a start. We can look at heart function in a very different way to ultrasound, which is still our main imaging modality. We can now quantify flow or measure exactly how much blood flow is going in whatever vessel we want. So there are particular situations where we want to have that information so we can decide what to do, such as timing of surgery, what type of surgery to do, when to do that surgery, whether surgery is possible even, as opposed to just treating medically.
And speaking of surgery in particular, how does this machine help us when we are performing procedures and operations on children with heart disease?
Well, the same sort of thing as you said for the neurosurgeons. We can assess the impact of whatever therapy we've done almost immediately. We can save from having multiple anaesthetics to do that same thing.
And previously this kind of imaging would be performed with X-ray, which involves a lot of radiation, but with an MRI machine it uses magnets, which means we are saving those children from that radiation as well. So Michael, lastly, can you tell us, from your point of view as Director of Cardiology, a very big and crucial component to this hospital, how does the support of the Victorian public help you on a day like today on Good Friday?
It's a huge help to us, and we can have a lot of standard equipment, but for us to push the boundaries of care that we're delivering, to have that excellence quotient, which we pride ourselves on and our hospital on, we couldn't do it without the people from Victoria.
Well, there you've heard it. We are striving for excellence always, and this is how we make our hospital a great hospital, delivering great care, and why we need your support. So please call 1300 APPEAL and